there are local changes in the microenvironment, in infiltrating cells, and indeed in the transcriptomic profile of the epithelial cancer cells. So a lot of science still to be done. Positive results do we get? Remarkably good ones. When we look at prognostic models, we often look at the hazard ratio that separates good prognosis from bad prognosis. This is one of the cancer-specific survival curves that we've got here, looking at survival across years after surgery. And you can see that by using our AI model and building it into another prognostic group, we can split our population of early-stage colorectal cancer patients into 3 groups. The green group has got a remarkably good prognosis, and in that setting, I would not offer adjuvant chemotherapy. The red group has a very poor prognosis, and there you could imagine, perhaps under a trial setting, offering intensive, perhaps triple combination chemotherapy of longer duration, whereas those individuals in the middle, in the blue group, one might consider giving 3 months chemotherapy or even single-agent adjuvant treatment. So we can personalise the treatment according to the likelihood of the tumour recurring and coming back. And at the moment we're doing a clinical utility study looking at our prognostic model and seeing if it changes clinical practice. The other thing that we're doing with our digital pathology in this enormously colourful and terribly complicated looking slide, at its heart is quite simple. A lot of mathematics, and again, I'm very blessed in Oxford by having some fantastic mathematicians, and by doing something that we call nuclear segmentation, we think that by classifying the nuclei, we can separate the various different cells that we find in the stroma, tumour cells, cancer, tumour-associated fibroblasts, lymphocytes, necrotic cells, healthy cells, monocytes, tumour-associated neutrophils, because what we understand is that the microenvironment of the tumour plays as important a part in its prognosis as the tumour mutational landscape. So we think about the tumour evolving, collecting a variety of different mutations, and that's what governs the behaviour of the cancer. That's not true. Of course that's an important element, but the cellular environment, the microenvironment in which the tumour finds itself, has a huge impact on behaviour as to how aggressive the cancer might be, how metastatic it might be. And this is because there are a whole range of different cell types producing different cytokines, creating a different metabolic environment, a different pH, for example, that have an enormous impact on the behaviour of the cancer, both good and bad. We're developing AI-associated tools that will allow us to dissect the tumour microenvironment, and this might help us predict what patients will respond to immunotherapy, certain cytotoxic drugs. It may even suggest new targets for therapy in colorectal cancer. And at the moment we're testing these tools in clinical trials to see if they help to personalise the delivery of adjuvant treatment. Again, I hope you have a fantastic meeting. Thanks again to Arthur for thanks again, of course, to Arthur for the invitation to speak to you. And of course, what I do hope to do is to come to visit your beautiful country soon, and hopefully have an opportunity to visit there. Thanks very much indeed for listening.
So if you have any questions for Professor David Kerr of Oxford University Medical School, you'll send them to me. I'll tell you more. So we have a mathematician. Seeing what Professor Kerr talks about. So that's why I invited you so that we can work on doing something with them in collaboration with Uzima University. So we can't have a cancer conference without having cancer survivors and cancer patients. So I'm taking this opportunity to invite Beatrice, who is a multiple myeloma cancer survivor, to come and give us a journey with cancer in our setup, so that we know the challenges from the horse's mouth. Welcome, Beatrice.
Good afternoon to you all. I'm Beatrice Ogango. I'm a cancer survivor of multiple myeloma. It was hectic, but we thank God we are here. It's just the way Dr. Rob was saying, early detection or community, whatever. Because I treated arthritis for 2 years without knowing anything. So one day I just woke up. That is now when they started more investigations. I went to biopsy, then I went to bone marrow. So from bone marrow, they found that there was multiple myeloma cancer. From there, I started treatment, as you know, with chemo, radiation. I know most of you know it. It's hectic, and it reached a time I was giving up because of the pain, expense, everything. But to the good family, the working people, and the support I got, I continued with my medication. Until now, I'm free of cancer. But even before being free of cancer, I had to go on some challenges. I was still having some pains. It's on my right hip. I was still having some pains that I could not walk. I was still walking on crutches. But later I went and did the cementless hip replacement, hip replacement. So at least now I can walk without the scratches. The pain is gone. Still on drug until further notice that I can't say, the doctor will say. But there are a lot of challenges. First of all, even if you want to go to the hospital itself, just going to see the doctor, because of mine I started with Russia, but I could not manage it. Because I was in pain, they said you go this side, you go there, you walk, it's all over. You know the way people move to Russia from here to here. So in this type of sickness, I think it's just general sickness, things should be confined in one place if possible. Even if you go to where we do chemo in Russia, I normally tell people, I just say, if it is Russia, then let me just die. Yeah, because the situation is pathetic. You wait in a line, even there's that chair for chemo. There are many people. You go to the hospital by 6, you might not get that chemo that day. They have to tell you come the next day. Tell me. But me, I was staying in Uzima. Somebody who comes from far, they have to sleep outside the verandas. When you reach for the chemo, they tell you that the drug is not there. What next? So you just think now, I just have to give up. So I think there are a lot of challenges with cancer patients. First, diagnosing the disease, and the way Daktari said, the community, whatever. Because even me, if I could have known, I had just started feeling pain in my hips, ignoring. So when it persisted, I had to see the doctor. You see, you just see small things, then we ignore. And it took me 2 years now treating arthritis. Then again, 3 years treating cancer. 5 good years. So unless we go the way the Daktari said, community, we start early detections. And B, if I go to Dr. Gutu, I tell him, Daktari, I'm feeling this. I hope you'll have to take it serious and do more research or ask questions. Because on mine, I was blaming the doctors. In fact, I walked all the orthopedics within Kisumu. Because when I go to Dr. Gutu, I don't get the right thing. I go to Dr. Roga, I don't get the right thing. Professor, I don't get the right thing. So I was in pain. But at least the last one, they diagnosed that I found I was having multiple plus myeloma. What I tell you people, cancer is very expensive, and taking care of it. That you need everybody within you. Even if you are not talking to Gutu, you will talk to him. Because you need assistance from her, or from professor or madam. You need people to talk to you, because if you are left alone, cancer is a walking down. And if somebody is not next to you or telling you anything, in fact, I told you I was giving up. During the radiation, I started radiation, within 2 days, I was down. Not eating, not doing anything. I could not walk, sleeping. Admitted. And you have to go for it. Radiation, if you start, you don't leave. I was being taken from ambulance, Nairobi Women's to Nairobi Hospital. Nairobi Women's to Nairobi Hospital. For all the radiation I did. But here we thank God. I'm here. So what I would like just to encourage people, be a good keeper of each of us. If you see me, maybe even some people might be wondering, why am I walking with scratch, laughing, even right now. I'm walking with because one of my legs is short. I have an inner sole that I had to change everything about my shoes. I have to walk with something within my shoes. I can't walk with the normal shoes now. So you see, it comes with a lot of challenges. But you just have to go on. Because if you are happy and you need this life, you have to continue fighting for it. I think that is what I can tell you.
Does anyone have a question? Beatrice? Any question?
For those who may not know,
Here to see you.
Beatrice, in this university, she's a leader who serves as food every day. If you come to this university, she's the one who will arrange. Even today, she arranged for my tea. I had guests. This one, a cancer survivor. Give her another clap.
Thanks so much, Beatrice, for sharing and joining with us. I think we are done with the speakers. Just to wind up, maybe Professor